So now we are using CAR-Ts as part of the late lines therapy. So in patients that have received three or four, at least three or at least four prior lines of therapy, depending on the European or the US label indication. So very late in the treatment journey. For sure, there in that setting, CAR-Ts have demonstrated a tremendous efficacy, but the field is moving to using CAR-Ts in earlier disease settings in populations that still have, let's say, an unmet medical need, either because they have exhausted all available therapies, let's say because they have already been exposed, as we have just discussed in the KarMMa-3 trial, to the main three classes of drugs, either because they have relapsed early after frontline therapy, and we have some data from phase 2 trials evaluating the use of CAR-T treatments in patients that progress within the first year or the first 18 months after frontline transplant or frontline therapy. Also, other populations of unmet medical needs, maybe, for example, patients that are lenalidomide refractory. And I think the next big trial that we are expecting to see the data is the CARTITUDE-4 that had just released. Know that the trial has met its primary endpoint. This is another phase 3 randomized study comparing cilta-cel to standard regimens in patients with 1 to 3 prior lines, all of them being len refractory. So I think that this is another big step forward to CAR-T therapy in myeloma. And the next, let's say, will be to see the data on the trials that are being done in the frontline treatment.